Hi, my name is Marcelo Evangelista. I am the practice owner of AV Dog and Cat Clinic. Today, I'm going to share another video, part of the 3 video series about cranial cruciate disease. For those who haven't yet watched, you may visit the link or click the link below for the part 1. So today, I'm going to talk about or discuss about part 2, which is the diagnosis of cranial cruciate disease. So what is cranial cruciate? No, just a wrap up of the previous video. Cranial cruciate is a ligament inside the stipple or the knee. So this is a similar structure to human, which is ACL or anterior cruciate ligament. Okay, so diagnosis involves a thorough physical examination. So it cannot be diagnosed by radiographs or by X-ray alone. So you need to bring your dog to your trusted veterinarian for these examinations to be performed in the clinic, because dogs that are showing signs of lameness, non-weight bearing lameness, pain, limping could be a sign of cranial cruciate disease. So as mentioned, there are different orthopedic conditions commonly seen or observed in dogs. One is hip dysplasia in the knee or is the stipple. There are two most common: the cranial cruciate disease or torn ligament, and then the patellar luxation. So to be able for us to roll out and to diagnose the condition, whether it is cranial cruciate disease, patellar luxation, or hip dysplasia, you need to bring your dog to your trusted veterinarian. Cranial cruciate is something like a bit difficult to diagnose compared to patellar luxation and hip dysplasia. Okay, hip dysplasia can be diagnosed solely by radiographs because you will see the luxated hip joint. Unlike cranial cruciate, which is the ligament rupture or torn ligaments, the ligaments can be hardly seen over the radiographs. There are physical examinations available that can be performed in the clinic. So one is medial buttress. So actually, medial buttress is not a method of examination, but it is a sign that is characteristic of cranial cruciate disease. What is medial buttress? Medial buttress is an inflammation or swelling on the medial side of the knee. So if this is the knee, example, no, I'm showing here a model of a bone including the femur, the tibia, and the stipple. Medial buttress means there is swelling or a bump in this area. So as you can see on my picture here, I'm doing examination on this dog showing sign of lameness. I'm holding with my two hands on both lower thigh area or in the knee region. So in other words, buttress sign is not a method of diagnosis, but it is diagnosed during physical examination. Okay, another method of physical examination is cranial drawer sign. So cranial drawer sign is very difficult to perform, especially in bigger dogs. We normally perform this procedure while the patient is under sedation. We need to sedate the patient, so we can also perform this procedure with the cranial drawer sign. But what is cranial drawer sign? The drawer sign means the tibia moves forward. The veterinarian will hold the femur, the distal femur, with his right hand or left hand, then another hand on the proximal tibia and pushing the caudal aspect of the tibia towards the cranial, and it moves if there is a cranial cruciate rupture. Okay, this is the cranial drawer sign test, and another method is the so-called tibial compression test. So tibial compression test is similar to drawer sign test. Okay, the only difference is that while holding with my left or right hand, depending on the affected leg or affected stipple, the other hand will be holding on the hack joint or in the pose, holding and trying to flex the hack joint and applying pressure with the direction towards this type. So it causes compression and try to move the tibia cranially. So similar to cranial drawer sign, tibial compression test is to detect whether there is a instability and translation of the tibia towards the head. The last one, but not the least, is of course the X-ray. So with X-ray is to detect or to check for some changes in the knee when it comes to the density, lucency on the stipple. For example, in this radiographs here on the lower left, this is a normal knee, and the second one here, there is arrows pointing towards the cranial and the caudal aspect of the knee. There's an increased lucency or radiolucency or increased radio density on the aspect of the stipple or in the joint, just caudal to patella tendon, as well as on the caudal aspect of the stipple here. So that is a sign of inflammation, and this dog has a back press sign also. So those are the common diagnostic procedure that we perform in the clinic. One is physical examination and then X-ray. Okay, so it is important for pet owners to bring their dogs to their trusted veterinarians in doing or trusting them for the diagnosis of cranial cruciate disease, because cranial cruciate diagnosis is not straightforward, needs a thorough physical examination and radiographs and proper understanding these different characteristic of diagnostic examination for cranial cruciate disease. So once again, thank you for watching, and if you haven't yet subscribed to our YouTube channel, please subscribe and don't forget to hit the bell button for more videos to come. And for those who haven't yet watched the part 1, there's a link there below. Then hopefully the third part or the last part of this video is how we manage cranial cruciate disease and what are the treatment surgical procedure that we are performing here to treat cranial cruciate disease. Thank you for watching and have a good day.